Hello, hello, hello. All righty. How are you? Hi, Rosa. I need the team to tell me if they can hear me or not. Please type in the chat. Oh, I guess you can hear me, Miss Rosa. And also, I want to know if my team is here. Ms. Mills, hello, hello, hello. I can't I guess it's kind of rendering and it doesn't tell me who's here yet. But hello, hello, hello. Hi, Nicole. Hi, Nolly. You know what? This is going to be something different. Yeah, we're going to wait a moment or two for a few more people to come in, but this is different. This is something that we've never done before. Not like this. So bear with us. We want to see what works, what is the optimal way to present. But just so you know, our goal is to guide. Yes, so this is not a traditional instructional class. We are guiding. I'm telling you some tips in between, and hopefully it helps. So let me know. All right. Good morning, Nolly. All right. So I'm going to get started. But first, I'm going to say hello to my team, Ms. Mills. And if Miss Dolly didn't come through the chat, she will be here. And so too will Mr. Sandeep. So let's get started. All right. So we're going to, I'm going to ask you, don't forget to like and subscribe to this, well, our YouTube channel. So I think what your view is, you can see the screen. Underneath this screen, like it up if you do, but don't forget to subscribe because you will get some notifications that are really good. All right, so I see the team is in. Now I'm ready to rock and roll. And welcome to you, coders. All right, so the purpose of this guided session is to reinforce, not re-instruct. We want to discuss coding guidelines and their relevance to the medical coding exams. We're going to do that. We want to strengthen your test taking strategies, and we're going to highlight those FTRs and those gems. I got some gems. All these instructors have gems. You're going to see them come from every direction in 2026. All right, we want to engage in discussion based learning. So I want you to talk to me. Talk to me in that chat. Let me know. We want to encourage collaboration and forensic accuracy. What is that? Well, it's coming. But I do want to tell you about this disclaimer. This class is exclusively for AMCI MCDC students and gold online LMS members and YouTube course students who are gold, right? So, and if you decided, hey, you're not going to go into the LMS, you're just going to follow along in the syllabus, this is for you too. All right, so attendance assumes that you've already completed the assigned coursework. All right, coders, so I want you to type in the chat. I want you to tell me if you know the assignment for today. Did I get it to you appropriately? Was it specified well enough? But I'm going to tell you, we're going to go in order of the CPT manual, the surgery section. So we're going to begin with integumentary system. So you should have already completed integumentary. And then we're going to have, advanced discussions. All right, Miss Rosa is ready to go. I know you, Miss Rosa. I'm not used to seeing your image. I missed you, and so good to see you. So good to see you, Miss Vina D. I see you snuck in here on me. Sandra Jean, welcome back. Hi, Miss Leslie. All right, let's get started. So again, this class is intended for discussion. Hmm, telling me to stay in the studio. Okay, I must have clicked on something. All right, so this class is intended for discussion, clarification, and reinforcement of previously studied material. This is not initial instruction. And if you are looking at this for initial instruction, you're going to be like, oh, something's missing. Yeah, maybe. All right, so we only have one rule. At AMCI, we only have one rule when it comes to exam preparation, and that one rule is do not use blind process of elimination. No, you gotta read the scenario because in the real world, you gotta read the scenario. And if you're not in the habit of doing so, you're gonna be at a disadvantage. Also, if you only practice for the exam, you're not possibly you're not going to be ready for the other exams that follow, right? Most employers have a pre-hire exam. And I'm going to tell you a lot of employers more recently are saying these coders that are coming through don't have a good guideline base. They're not ready. Mrs. J, can you help me train them more than usual? So let's get in front. Let's do things the right way. And I promise if you do it right, it will be right and you will be ready for the exam and the real world and AI. All right. I digress, but I am back. Now, I do want to let people know that you should subscribe to the YouTube channel and where you can find your membership perks, you can find it here. So those special videos or anything, you can find it there. If you're in the MCDC course, we put it in your course so you don't have to look for them. All right? All right. So just want to let you know that. Also, playlists can be found on the playlist button. And while everyone can see, everyone, whether you are gold or not, or platinum, everyone can see this playlist. However, all of the videos on the playlist are only viewable by gold and platinum. Okay, so there are 6 here, but um, that's just the way it is. Okay, so I want you to do that. Also, too, if you want to cancel at any time, click on the button up at the top with your image and then click Manage Your Account. I think that's all it is. It's like membership, manage your membership. Okay. And when your membership goes away, your course goes away if you are a gold student. Just thought I would tell you that. Also, announcement, the 2026 Optum textbook promo code is here. Yes, you can get discounts, AMCI discounts using promo code AMCI 2026. Okay. Also, just so you know, you can purchase your ICD-10-CM, your CPT 2026. You can purchase your HCPCS Level 2 when it becomes available. HCPCS Level 2 is not available, but the promo code is, as you can look at this discount, really nice discounts. Use the promo code. Definitely. Now, if you don't use the promo code, you can buy it from AAPC or you can buy it on Amazon. I just did this search today and I'd rather save about $25, $20 to $25 easy. All right. So definitely use the promo code. Now, this week we are going to focus on integumentary system. We're going to we're going to guide you through your LMS in the integumentary, on the integumentary system step, that module, only the integumentary system. We're going to focus on some key guidelines with those nuances. We're going to actually show you how to apply FTRs. Those are facts to remember. We're going to discuss appropriate integumentary modifiers, give you some application of practice, and hopefully we're going to bring you one step closer to medical coding mastery. And somebody asked a very good question. They said, what is an LMS? You know what? How appropriate. Great segue. LMS is Learning Management System, LMS, and that is where your learning is managed. Whereas if you're in the YouTube course, your learning is not managed because it's just on um, you just have a syllabus and you just kind of use the syllabus. Now, this in front of you is the platinum students view. They're in a different LMS, and anytime they complete a step, it turns green. So they begin with the goals of the week, the RSVP. It tells them go ahead and RSVP for your 30/30s, RSVP for your group studies. So we kind of walk them more by the hand. And as you can see, there are 4 integumentary videos. This is step-by-step instruction on how to code most of those procedures within the integumentary system that they'll likely see on the exam and those with the nuances. Also, they have their own playback, not from YouTube, but their own playback. It's a 3-hour class, so definitely more content. Then they get to chun their integumentary system. Their chun is integrated right um, in the module. Also, they watch more chun tips. They got another extra video. They have the reading, the Bucks reading. They have their MCG practice quiz. They also have another quiz, and then they have an exam. Now, I'm going to show you the gold course, and then I'm going to compare the two so you know they're not the same. I want to impress to both parties that they are not the same. All right. So now this is the YouTube Gold online course. And as you can see, they download their PowerPoint to their playback from YouTube. Then they have to read Carol Buck's. It's arranged differently because of something I'm going to tell you later. Also, there's a YouTube video here. Then they have their CHUN, their CPT manual for integumentary system instructions. That's not the CHUN, but the instructions. And there is a link to the pages, all of the pages. So you'll have to kind of, just make sure that you grab the Integ page. Also, they've got a quiz. That quiz is also from the MCG manual. Then they have another quiz, right? And then they're asked to join the CHUN group, which will help them with CHUN. And there you go. So it's essentially the two are different. Of course, the MCDC course is preparation for 3 certifications. Provides more instruction. You have private group studies, more access to the instructors. They have more quizzes. They also have an exam. And you know what? Reading in the MCDC course is not essential. It really isn't, but it is there to give more structure for those who like the reading and, the reading learning. Okay. And it also could fill in some gaps, but I don't think so. I think we've already filled in those gaps. Now, whereas the gold LMS, these are videos. This course is videos from the YouTube course. From YouTube. Yeah. These are YouTube videos. These primarily are not. These are quizzes. You have the same quizzes, but no exam. And reading for the gold course is essential because it will kind of fill in the gaps where there are for some people. Okay. Yeah, someone said, yeah, that the Bucks, she felt like it was a review. Yeah, so you don't really need it. And in 2026, we will not the Bucks, excuse me, 2027 Bucks will be a not a required reading but recommended because this is an independent course. Most of the students are independent. So we want to make sure they're doing their work, right? All right. So if you have questions about the LMS, go ahead, type in the chat. I am very, very, very happy to answer. Now, we're not going to spend the whole day in here. We're going to get started with integumentary system. You all ready? Let's do it. All right. So the beginning of the surgery section, you'll see the surgery guidelines. These guidelines are applicable to all of the surgical procedures in CPT, 1,000 through 60,000 series. You will have to know what services this service guideline is, and I will tell you because it's new. It's green. It's new for 2025, not 2026. Essentially, they've added some new codes in the evaluation and management section. Pretty much, they are um, telehealth, telemedicine codes, and they're just letting you know that moving forward, those codes will be in the medicine section. They will no longer be, I'm not going to say no longer, but their home will be the medicine section. All right. Make sure that you understand CPT surgical package definitions, follow up care for diagnostic and therapeutic. Need to know what to do when you have supplied materials, when you're reporting more than one procedure or service, what to do, separate procedures, and unlisted procedures. Oh, yeah, we got another page. And special reports when one is needed. And this is more for the real world. Imaging guidance. Read it. Surgical destruction and foreign body or implant definitions. Again, these general coding guidelines apply to all of the sections and they always apply unless a specific guideline supersedes it. Someone asked about the chun. When will we have chun on the 2026 books? The chun class, there will be a chun class in March. Okay, so we're going to give you an opportunity to get your books chunned, or if you want to wait until March, I'm going to walk you step by week by week by week, and we're going to go through the CPT chun. Great question. All right, so now we're going to begin our not instruction, but evaluation of the integumentary system. And I want you to look at this table of contents. Lately, I've been putting it up before almost every time I teach. And I just want you to become friends with it. Just know what's here, right? So you got final aspiration, you have skin, subcutaneous, and accessory or structures, and the procedures here. Remember, those blue bold are procedures. Make yourself aware. Then you've got nails, pilonidal cysts, then introduction procedures. What is introduction? What is it? Well, it means you're going through the skin, like injections and so forth. Then you've got repair closures. Look at all of these repairs. We're going to talk about that soon. Then destruction procedures and breasts. Now, I want to know what you already know. The first subject will be debridement. What do you know? Can you answer this question? Of the following, which best describes the correct coding guideline for debridement of wounds in the integumentary section? A. Code to the deepest tissue removed. B. Code to the deepest tissue removed based on whether the debridement is for infection, necrosis, open fracture of dislocation, or general debridement. C. Code all levels and append modifier 59. And D. Code based on whether the wound involves infection, necrosis, or open. So the question is, which best represents the correct coding guideline? All right, some people are answering. Thank you, Ms. Mills. And this is never a question that I've ever asked. I just want to know what you think it is, right? Yeah. All right. So not too many people are answering, and I didn't expect that. But the answer is B. And those that did answer, Christine and Vina D, yes, it is B. And we're going to talk about why it is code to the deepest tissue removed based on whether the debridement is for infection, necrosis, or open fracture or dislocation or general debridement, right? Yeah, it's B, and here's why. Here is the section for debridement. And just so you know, the specific guidelines are typically found underneath the blue bold. Okay, right? And your guidelines are here and here. And at the code level, too. If you just read it, it will tell you. And if you didn't know, there are three sections or three types of debridement, right? Yes. The first, these codes are for infected skin. And these are not coded to the deepest tissue level. They're coded in terms of the total amount debrided. This section here is for debridement of necrotizing soft tissue infection. And these kind of go over here too. And they are coded according to the location on the body. First code is for external genitalia and perineum. This code is for the abdominal wall with or without fascial closure. And this one is for all three, the external genitalia, the perineum, and the abdominal wall. And these are not coded to the deepest tissue level. No. Now, when we start talking about debridement down to the deepest tissue level, when we have a debridement of an open fracture and or dislocation, this is coding down to the deepest tissue level. 11010 is down to the skin and subcutaneous level. 11011 is down to the muscle. 12 is down to, wait. This is muscle and this is bone. 12 is bone. Now, the general or non-specific debridement are 11042 through, I believe, 47. It's not on here. But these are general or non-specific, and they are coded down to specific areas. The subcutaneous, the muscles and fascia, and the bone. Okay, so it's the size and the location. How far down? Now it's important that you watch the keywords. Very, very important. Are you all with me? I just want to know. I need some feedback. I need to know if this is, had you even thought of this? Or did you just kind of say, hey, I'm going to, okay, someone said, hey, they're following. Good deal. I want to know. Let me know at any time. Now, also, the way to code each of these, you can find them in your FTRs. Like, I said, hey, read under the blue bold and you can get the FTRs, but we've kind of read them all for you and we've simplified all of them. So for the infection, the necrotizing soft tissue infection, the abdominal perineum and genitals, this is the guideline. These are the guidelines for debridement at the site of open fracture or dislocation and debridement all others. These are your guidelines and these are your FTRs, and you can find them in the MCG manual. Now, I won't be showing all of the FTRs for each section, but I am doing it today just so you can see the value of it. And it simplifies your guidelines, and it also just kind of makes it easy. It just makes it easier just to kind of follow. But I know that doggone MCG is expensive. So some people can't afford it. And if you can't afford it, you can no sweat. You can just go right to that section and you can read the guidelines. Now, some of them are a little difficult to understand, but when you read it multiple times, it kind of makes sense, right? All right. So I want to end the discussion on debridement with a gem. And the gem is know the type of debridement being carried out and the deepest tissue or the total area debrided. Someone said yes. Someone asked, is the 2026 coming out? It usually comes out the first week of January. And I'm going to tell you, if you're saving money, don't get the 2026, keep your 2025. Okay? Save the money if you can. All right. So now it's time to move on to another subject that has nuances. Biopsies. What do you already know? Of the following, which is the most complex biopsy? A, tangential, B, incisional, or C, punch? What say you? All right, good job. Some of you, all right, you're coming through, you're coming through. And you know what they said? They said B, incisional. And that is absolutely correct. Why is that important to know? Well, I'm going to tell you in a moment. It's important to know if you have multiple, you need to know which one you have to sequence first. All right. And just want to point out, you've got your guidelines right up underneath biopsy. They are, kind of extensive, but I think this chart really brings it home. Essentially, you code for the appropriate biopsy by using the appropriate biopsy code. However, when you have multiple biopsies, you should follow this chart because it'll kind of keep things in perspective. I'm going to just to tell you that when you have multiple biopsies, you have to know which one is the most complex because you only code one biopsy primary code. One, you code the complex. Then you code for the subsequent or other biopsies using the add-on code, but not just any add-on code. You're going to use the add-on code that's pertinent to that biopsy. If you look up here, you see tangential biopsy, it's got its own add-on code. So if you have a tangential biopsy in the setting of an incisional biopsy, you're going to use the primary code for incision, and then for secondary code, you're going to use the add-on code for the tangential. And it says report 1103 in conjunction with any of these primary codes. Hopefully that makes sense. Now, another thing that I want to point out, whenever you have an exam, sometimes they don't say the type of biopsy. They might say the patient came in for a biopsy. However, the doctor shaved shaved the lesion with a scalpel, right? So shaved the lesion with a scalpel. Essentially, if that documentation only says that, what will you code? Will you code a tangential biopsy? Will you code a punch biopsy? Or will you code an incisional biopsy? So, if you'd like, go ahead, type your answers in the chat. But I'll tell you that that is a tangential biopsy. They take the scalpel and they pretty much slice or shave the lesion. Whereas a punch biopsy, think of it, exactly punching. They take this tool, this punching tool, they punch down, grab the specimen, and that is the biopsy. Whereas incisional biopsy, they're either incising in the skin around the biopsy and removing it, or directly into the lesion and removing it as well. So you have to know what that process is, and you also have to know the complexity. And we've just said that the incisional is the most complex, followed by the punch, and also followed by the tangential. So outstanding, outstanding that you knew that. And if you didn't know it and you learned something, outstanding. But I do kind of want to um, just leave with this. When you have multiple different biopsies, remember to code only the complex one first, the most complex. Then use the specific add on codes for the subsequent complexities. All right. So just want to draw your attention to the FTRs from the MCG manual for coding biopsies. You've got tangential, what to do. And also too, pay attention to um, the keywords. You use a sharp tissue. They're scooping. Also, too, they do scooping, more scooping, curette, shaving. They use a blade in its epidermal tissue. Also, the biopsies for punch, they're punching using a sicular or cylindral tool. And incisional, they're incising down through the lesion or around the lesion. And it's typically full thickness is going way down. All right. So that question was a little tough, and they got it. You guys got it. Great job, Christina. Great job, Miss Rosa. All right, so what did you learn? What did you learn? Of the following, which best represents the correct coding guideline for multiple skin biopsies performed during the same encounter? A, code all biopsies under a single lesion code using quantity. B, code each biopsy separately based on the anatomic site only. C, code only one biopsy regardless of the number of lesions sampled. D, code the most complex biopsy method first and add the corresponding add-on codes for each subsequent biopsy. That's right. Good job, Aaron, Christine, and Rosa. They got their answers in. And um, ooh, what's that? GG, Angie? I think that's what it is. Let me know if that's right. Kabesh, Sandra, Star Wars girl. All right, you all are rocked it. It is D. Remember that, okay? It's going to make your process so much easier. And knowing how biopsies are carried out will also help when the type of biopsy is not mentioned in the documentation. Great job, great job. All right, so we're going to turn our attention over to excisions. What do you already know? Of the following, which best represents the correct coding guideline for multiple excisions performed during the same encounter? Now, these are excisions. Code all excisions under one lesion code using total combined diameter. B, code only the largest lesion and append modifier 59 for the others. C, code by the number of sutures or the total wound repair length. Or D, code each lesion separately by site, pathology, whether it's benign or malignant, and measure by the narrowest margin, including the lesion and margins. Yeah, we let chat come up with these questions. He did okay. Okay, good job, good job, good job. I do want to kind of move along. I am not going to go over our time. So the answer is D. Yes, you got to code each lesion separately and you got to code it according to the site, the type, and the size of the lesion for the most part. There's a little more. And you know what? We know that these lesions are divided based on whether or not it's a benign lesion or malignant. We know that. But where I find most people get hung up is the math. And I'm not going to do any more math for you. What I am going to say it is the size of that lesion plus the margin. And anytime you have a margin, you must multiply it by 2. You have to have 2 margins, right? Yeah. So don't let it bother you. And if you need more instruction, I'll do a math, on how to measure these lesions, but I don't want you to get caught up at all. It's just what I would do first is look for the margins. Sometimes they give you both margins. They'll say the margins equal, or they'll just give you one margin. No matter what, they must be equal. You have to multiply whatever that number is by 2, then add it to the size of the lesion. Great job, everyone. Also, these are the FTRs for benign lesions and malignant lesions. There's really no different. I do think these key words really keep you focused. When it's benign or non-cancerous, it's benign. When you see cancer like basal cell carcinoma, squamous cell carcinoma, melanoma, that is cancer. All right. So they're coded the same. You code each lesion separately. It's coded according to the body area. Oh, these lesions are bundled in adjacent tissue transfer. So these excisions are bundled into the ATT. Remember that. And I'm going to tell you why. Also, when it is a malignant lesion, you got to use modifier 58 for re-excision if it's during the postoperative period. So if they have to do that, you got to do it. And also, these subcutaneous lesions means it is below the skin. It's no longer skin. If the documentation says this is a subcutaneous, below the cutaneous, you're going to be looking in the 20,000 series, the musculoskeletal system. All right. Now, my gem, my gem for coding these lesions, you need to be able to recognize the difference between benign and malignant codes on site. On the left, 114, the lower code series is benign. On the right, 116, the higher code series, that's malignant. That simple. If you have a test question and the documentation is describing cancer, on site you're going to eliminate any code with 114 at the beginning. And that's it. That's it. All right, so now it's time to move on. Time to move on to repairs. What do you already know, coders? Of the following, which is not a repair? A, adjacent tissue transfer. B, closures. C, skin replacement surgery. Or D, all are repairs. Go ahead, type your answers in the chat. Okay, coders, type in the chat. A lot of people said B. What is a closure? What's another word for a closure, a skin closure? Go ahead, put your answers in the chat. And while you're putting your answers in your chat, I know you're a little bit behind me. A closure, it are sutures. Stitches. Yes, Sandra D. Yes. Sandra Jean. Yes. Stitches. Is stitches or are stitches, is that a skin repair? Is that a skin repair? Yes, indeed. It is the most common skin repair. So it is a repair. Anything used to repair skin is a repair, is an adjacent tissue transfer, a skin repair. When they're taking the skin from the adjacent part of the body or adjacent to the wound and stretching it over to repair the wound, an ATT is a repair. What about skin replacement surgery? Is skin replacement surgery done to repair the skin? Absolutely. Absolutely. All of these are repairs. So, this is why you generally don't code more than one repair to a wound. Yeah. So if you have a scenario and it's giving you an ATT code and a general, suture code, you know you're not going to code both. In fact, the guideline is going to tell you don't code them both. It's going to tell you the one to code. So I just think these conversations really put things in context and really help um, build your aptitude as a coder. Not just that, it also makes you confident, right? So if you look under the repair section, see, it's the category is red, right? And underneath this section, you have your general repairs, your general sutures, your simple, your complex, and these are in blue. Your simple, your intermediate, and your complex. I just kind of left some of this out just for the sake of showing you this. But also, look what else is in blue. ATT. ATT is blue and it's under the repair section. Okay, just saying. Now, also, you've got skin replacement surgery. It's still blue. It's under the repair section. Flaps are, excuse me, let me just, surgical prep, wound prep is under repair. Autographs, um, autographs are repair. Also, skin substitute grafts are repair. Flaps, skin and deep tissue flaps are repairs. Other repairs, and even burn treatment. That's repairing a code. Excuse me, repairing a code. That's repairing a wound. So they're all repairs. So it's really important that you pay attention to the guidelines and it gives you some little, the parenthetical guidelines tell you stuff, and your guidelines underneath the blue bold give you guidance, and it says basically you don't code this and this and this, because now that you know what you know, it makes sense. You're not going to code multiple repairs for a repair procedure. All right, so I encourage you to look at the repair FTRs and just kind of make yourself familiar, and that's that. Now we're getting ready to kind of kind of get to the end of things. Just want to make you aware that there are some pertinent modifiers for the integumentary section. The most common that you'll see will be modifier 59, no doubt, especially if you're dealing with a lesion. Modifier 59. Now there are some times where you're directed to use modifier 51 when you're doing wound prep along with skin replacement. They direct you to use modifier 51, and the FTR that we've created tells you that, so you know. All right. Now, modifier 25, you're going to use this, and this is only used for evaluation and management, and it's going to be used on the E&M code, not the integumentary surgical procedure, but the E&M. And commonly, you'll see that you can code these um, integumentary procedures with the E&M service. It's allowed. All right. And I got a gem. And this gem is that modifier 59 has guidelines specific to lesions. And you can use modifier 59 when there are separate lesions. So that's your buzzword. That's your buzzword, lesions. Modifier 59. Yeah. Somebody said, "Hey, it's confusing." And you know what? Somebody said something about Mohs, excisions and destructions, etc. Um, if you need clarification, I am willing to help you with that. So, just want to let you know that these sessions are designed to just kind of be short and sweet and to the point and give you instruction for the sections that we are on and give you some tips. Now, and also too, because you all are advanced and you're in that section already, or if you completed it, I'm able to give you some things so that you can bite on it and really, really elevate your understanding of that section. So I don't know if the team has the survey. I do really, really want to know you um, what you are thinking, what your thought process is. Is this type of instruction, like guiding you through the course, helpful or not? Let me know. But I do want to let me get this in the chat, and then I'm going to tell you what we'll be talking about next week. What we're going to be talking about next week? Yes, we're going to talk about musculoskeletal and respiratory system, and anything that you put on this survey that you say you want to discuss about musculoskeletal or um, respiratory system. All right. So this is my way to be able to answer your questions. So definitely do that and let us know. So I just want to just say thank you to my team, Ms. Mills, Mr. Sandeep, Ms. Dolly, and thank you to you coders for coming. This is new, so it's really important that you communicate to me whether or not this was helpful. All right. So if you have a question or two, I'm here to answer. And if not, I'll see you next week. Thank you, Miss Rosa. Thank you, Gigi. Hi, Baby Ruth. Thank you for coming. Thank you, Christine. All right, everyone. Until next time.